What inspired me to start looking into airway issues is my older daughter, Syra. She has inspired a lot of my practice, and this in particular was something we noticed when she was about 4 years old, that we were having some sleep issues. When I couldn't find anyone that would address her issues or find a solution, I started to look into things myself. That first started as a tongue tie journey, but then I realized that the tongue tie is a very small aspect of the overall craniofacial oral complex. Pediatric airway issues, the most common things that we see are structurally kind of a smaller upper jaw. So the palate being narrower, the teeth sometimes showing some of that narrowness with their positioning. Mouth breathing is a big sign of some upper airway dysfunction. So we want to look at the way our kids are breathing. A lot of times when they are mouth breathers, we see a lot of chapped lips. We also see that those kids don't really know how to blow their nose, or they have chronic congestion. On the sleep aspect, the things that we see most commonly are snoring, mouth breathing, teeth grinding, lots of movement during the night, bedwetting that is not age appropriate, getting up in the morning cranky, kind of the bags or the dark circles under the eyes. And then eventually we start to see a lot of behavior change. What we're seeing as a dental community, as an airway specialist, is that if we can address some of the sleep concerns and we get that quality of sleep where the child can actually be restored, a lot of those symptoms start to resolve. So they're really starting to see the value in not just the procedural intervention or the appliance intervention of a tongue tie release or an expander, but really in the value of myofunctional therapy as well.
If we can optimize those resting postures, help the patient breathe better, they're going to sleep better, and sleep is king. If you're not sleeping well, everything else kind of starts to go down and spiral.
Every child that comes into this office does get screened for sleep disordered breathing and put into a risk category depending on what they're presenting physically and what the parents are reporting in terms of their sleep presentation at home. Generally, when you come in to see us, you're not only getting sort of your nuts and bolts tooth checkup and cavity screening, but you're also getting a functional assessment for sleep, breathing, feeding, speech. For most people, the reason why they need an expander or they have smaller airways is because we have some underlying muscle dysfunction. So when we talk about sustainability of airway treatment and expanders and tongue tie releases, we have to make sure that those underlying tongue mouth muscles are working correctly. Otherwise, we're really setting ourselves up for a relapse case and needing to do more intervention later.
We do passive and active exercises where we are making sure that the tongue knows where it needs to be after the procedure. It knows where it's supposed to be resting. The lips know where they're supposed to be going. So after the procedure, they can hopefully seamlessly transition into more appropriate lip and tongue resting posture and nasal breathing.
The majority of our patients that are in an airway program with us are seeing myofunctional therapy, or if there's a speech concern, they're also seeing speech therapy, because we need to address the fact that these muscles are what got us here in the first place.